the standard way that you would do a blood glucose curve on a dog or a cat is they would have their normal breakfast, have their normal dose of insulin, they'd come into the hospital, and we'd keep them for, 10 to 12 hours, doing blood draws every few hours to kind of map out their glucose curve, which is great, except for it has two kind of main drawbacks. The first being they're in the hospital, so they're stressed. So maybe their blood glucose isn't exactly representative of what it is at home. And the second being, you don't get an overnight curve. So you're working with kind of half of the normal information that you would. And you can extrapolate. You can say, okay, my dog eats the same amount of food for breakfast and for dinner, so we expect this to work similarly, but that's not always the case. So what's really helpful about using it as CGM is that not only are they in their owner's home, not only do we get multiple days of data, and we get many, many more time points, again, readings every 5 minutes or so instead of every hour or two, is that we get to see that overnight data and see if the insulin's working for them in the way we would expect. Or if, I have a dog who doesn't eat a great breakfast, but eats tons for dinner. So does he need more overnight insulin? Our guess was probably, but we didn't want to give him more insulin without checking because the owners weren't awake. And especially in a dog, that could be extremely dangerous. So the CGM data kind of showed us what we were expecting, and that the dog needed more insulin at night versus in the morning to compensate for the greater amount that he was eating. So we were able to really dial in his blood glucose control a lot better by having the advances in technology that we do with the continuous glucose monitor.
And otherwise, I guess you would have just had to be more cautious with the insulin and keep his blood sugars higher. Is that right?
Yeah. So in dogs, especially given their shorter lifespans, we worry less about the really strict control that people worry about. The main kind of idea is the dog's quality of life good? Are they drinking a lot and peeing all the time? And do they feel, not so hot? Or are they drinking kind of a relatively normal amount of water? Are they peeing kind of what a normal dog would? Do we have good enough control that, we're keeping them in a good place in terms of health and, mainly their quality of life? I find for the owners that are, willing to do it and willing to, you have to shave a little spot on the pet's fur. So it's going to be slightly uncosmetic for a little while until that hair grows back. And you do have pets that scratch it off. So if you can kind of deal with those risks, you just get so much more data and you're able to make better choices about what amount of insulin the pet needs. Or, I've had some patients where we would assume that from their kind of 12-hour curve during the day, their insulin's working well, but we find they actually need a different type of insulin, a different duration of insulin because of what we see during the evening hours.
Wow, that's incredible. And I mean, I've heard about the exact same thing in humans. People that didn't have a CGM and thought they were doing okay at night. And then they started wearing a CGM and they realized that every night they were going dangerously low in the middle of the night. So that's incredible to get that information. What do most of your dogs think about wearing the CGM?
That's a good question. The good news is the CGM technology has come so far that it's really not painful to place. We shave a little square, we prep the area. The freestyle placement is the same as it would be on a human. So it's pretty easy. It's a tiny little wire that goes underneath their skin that gets the readings. So they really tolerate it pretty well. Some do have some irritation, so we find that some dogs can scratch at it. So that's, the main way where we, have a lack of information is that if they decide that it was a little bit itchy and they decide to scratch it off, and then all of a sudden you're out the cost of a sensor. If there are vets out there who want to try it, but haven't done it before, it's really pretty straightforward. So if you have owners that are more involved with their pet's health and want to do everything they can to make sure they've got great control and, want to kind of, fast track things in a way, because this lets you get a lot of data in a short amount of time, don't be afraid to try it. It's a really cool tool. I'm a little bit of a data nerd, so I love seeing those curves. But if there's someone that wants to try it and wants to reach out to me, I'm happy to chat. But don't be afraid just to go ahead and try it, because it's a really cool technology and it can be really beneficial.
And it's easy to put on, right?
So easy, so easy. You can put it on it in a regular appointment time. All you do is you shave a patch of fur that's roughly a little larger than the size of the sensor. You prep the area, and at least with the Freestyle Libre sensor, there's a kind of a contained application device that's already there. So you just essentially put it on the animal's skin and you press a button, and they don't jump. They don't, there's a noise. So some of them kind of turn around and look at what you've done, but they really don't seem to react to the placement at all.
Wow, that's awesome to hear. That's really, really cool. Thank you
Yeah,
so
it's
much.
a really neat piece of technology, and I'm always thrilled when one of my owners decides that they want to go ahead and try it, because we just got to get a lot of good information, and really helps to ensure that we're on the right dose or make changes as needed to make sure that we're giving that pet the best health care that we can.
Well, thank you so much for sharing all this with us, and that's really generous of you being willing to speak with other veterinarians that might be interested in trying it. That's really cool.
Yeah, of course. There are a lot of people out there in the field that are a lot more of an expert than I am. So, if you talk to your local internal medicine specialist, I'm sure they'd be happy to chat too. But the good news is, it's really straightforward enough that it's something that any general practice vet can do.